Hi, I'm Karen Murphy. Welcome to this short training today, something that you can watch on your morning break or on your lunch break maybe. Looking at individual therapy versus couples therapy. We've called this why couples therapy isn't just individual therapy times 2. To say maybe a little bit about me to start with, as I say, I'm Karen Murphy, and I set up the Institute of Couples Therapy over 2 years ago now. It was in response to a demand from two sides. One, a demand from clients for couples therapy, and secondly, a demand from therapists for good quality couples therapy training. I started working with couples close on 10 years ago now, and I have, you could call it the good, the bad, and the ugly. It's my journey with couples. I struggled with working with couples for a long time and struggled to find a way of working that really resonated well with the couples and resonated well with me. And I have found a way of working now, an integrative way of working, that has really made a tremendous difference to my practice. And that's the way that I train within the Institute of Couples Therapy. It is a model based on differentiation. It's an integrative model based on differentiation, based on systemic family process, based on Gestalt, and really underpinned as well by really strong relational practice. So the object of today is particularly maybe for those of you who may be working with individuals and who are wondering about what is different in working with couples versus working with individuals. How is it different? Is it different? Why is it different? Those questions I'll be covering today and in the next webinar as well. It's not a webinar, it's a short training. I'm so used to doing webinars. So just to, as I say, give you at a high level an idea of what does couples therapy look like versus individual therapy. And I said I'd start with actually an email that I got through yesterday. And that email was from a couple that I had worked with for over a year, and they are just about to have their first baby, and they have just made a commitment to get married. And they sent a thank you to me to say that their relationship has really grown and is stronger, and that they're a better couple and a better family, and in preparation of being a family from the work that we've done together. So the impact that couples therapy can have on a couple and have on a family is so significant. I think it's one of the most significant things to improve people's relationships. I often say that, and I don't say it lightly, that when everything boils down, the way I put it sometimes, if the world ended tomorrow, if the world is about to end tomorrow, the people that you'd want to reach most to are those who are your closest to, and that being your partner, your husband, your wife, your kids. So having those relationships being as good as they can be really is significant, because they're the people that are with you through literally thick and thin. So for the celebrations, the person who you want to phone when you've got really good news, the person who you want to reach out to when you've had the worst news of your life, the person who excites you, the person who gives you comfort. So it makes a tremendous difference to the quality of our life if our relationship is struggling. So, and then thinking about working with couples and how we work with couples. And one of the things that I have heard a few times, and it does annoy me, I have to say, when I hear it, because it's so not true, is people saying, well, sure, couples therapy is just like just doing individual therapy with two people in the room. And that is absolutely not the case. And that's not in any way that you would be working with couples. There may be an element of that comes into the work, but that is not the focus of the work. I'm in Ireland here. Some of you might be watching me from Ireland. Some of you might be watching me from further afield. In Ireland, in the UK, in Europe, there has not been much more integrative forms of couples therapy training available. There are some of the big like one model methodologies, like Gottman, like EFT, like Imago, like 𝐟𝐢𝐫𝐬𝐿. But with regards to a real more integrative approach, that isn't much available at all. There are some out there, but there's not a lot. There's not a lot for the number of therapists who are really looking to train in this area. And that has meant that there are some that are, going to get couples therapy, and they're coming out of it not having a good experience. And I often hear that again and again. So my passion is to really provide good quality professional training to qualified therapists, so that when they are working with couples, they're doing it in a really competent way. I can't emphasize the importance of that. So then going back to thinking about what is couples therapy? What are we doing? Think a minute yourself right now as I'm giving you some information here. Think, what do you imagine the difference would be? You have two people coming into the therapist room, often frustrated, often angry, often despairing, and hoping that you as a therapist is going to help them in some way to improve their relationship. Where do you start? How might you think about it? And if we come back to an individual coming back into the room, so working with an individual client, and obviously there's no one individual client. Individuals come in for all sorts of reasons and with all sorts of difficulties that they're experiencing. And individual therapy really helps someone get to know themselves, the intrapersonal, inside themselves. So self-awareness, get to know themselves better, get to know their wounds, their pain, their traumas, get to understand and share difficult experiences that they've been through, get to share where they're stuck and unable to move forward, maybe look at their life direction, patterns in their life that keep repeating, coping strategies that might be things around disordered eating, might be an unhealthy relationship with alcohol or drugs. So it could be issues around social anxiety, self-esteem, but it's all coming back to then our exploration of what's going on inside the person. How do they understand themselves? What sense do they make of themselves? Do they have a very negative viewpoint of themselves? So the process generally is really supportive, particularly, I have been trained as a humanistic psychotherapist. Compassion, empathy, understanding, congruence, unconditional positive regard are all parts that we are as therapists are bringing in to really help a person come back to themselves, understand their feelings, their thoughts, what's going on in their body. As I say, it might be some deep trauma work that's going on based on what they've experienced in the past, and understanding their family background and how that has shaped them as a human being. So as I say, it's intrapersonal, inside themselves. In couples therapy, you don't have just one, you have two. So in couples therapy, it's the relationship is your client. So it's not just one, it's not just the other, it's the relationship is the client. That can be hard. It certainly was hard for me to start with, to get my head around that, because it's like I can't see the relationship tangibly. So how can the relationship be my client? So the relationship dynamic and what's going on in the interpersonal between the couple is where our curiosity focuses. So the couple may be hoping to improve communication, improve connection, get out of stuck patterns. Often they're coming in trying to figure out how to navigate and negotiate differences that they have and that are coming up in the relationship. They come in often thinking that the other person needs to do something different in order for them to be okay. If we were to take an individual lens, we would be looking at each of them and saying what's going on here and what's going on here. But then that does not take into consideration that each person in that dynamic impacts each other. And as one person impacts each other, that impact has an impact back from the other side, and then back again, and then back again. And you have a co-created system. Something that is really significant with regards to couples therapy is that as the therapist, that we're holding a neutral position. And that is probably one of the most challenging things that we have to do as a couples therapist. But through the years, I've found a way to be able to do that, which for me, it just makes a whole load of sense. And I'll say a little bit about that. So you have a couple that come in, and often there's one partner that is acting out more. And acting out might be the behaviors are more overt. So it could be angry outbursts, it could be shutdown, it could be, kind of strong withdrawal. So it's like they're not doing something in the relationship that the other partner is hoping for. And what they're doing is quite visible. So it could be very easily to get lured into a sense of that's the problematic partner who needs to be worked on. And whilst that may be the truth, in one lens that we're looking at it from, that person overtly is doing something that's more problematic, is not the lens that we take in couples therapy, because we take a systemic process lens, which says, how do this couple fit together? So if you have someone who is not emotionally available with regards to their interactions in the relationship, how is their partner maneuvering around that then? How does that impact them? Do they get angry? Do they shut down? Do they collapse? Do they bring themselves in and say, there's a real issue here, I'm trying to reach you and I can't, what's going on? So all the time we're curious to understand what's the process that's happening in this couple. Within couples therapy, that will actually even show up in the room. So in individual therapy, often the person is reporting about things that happened to them. They were angry yesterday at work. They were upset with the family member, but they were talking about it from a distance of it happening. Whereas in couples therapy, you actually can watch the process play out in front of you. So that's significantly different from individual therapy. There are other aspects that I will be explaining and looking at, and I will be doing that in the next short video that I'm going to make. I think that's probably a good level of information for you to have at this point. So thank you for your attention so far, and keep a lookout for the second video where we'll be going a little bit more again into what are the differences between couples therapy and individual therapy. Thank you.